2016, there have been like 2 million confirmed cases with 20,009 deaths as reported by our WHO. And as of now, as of 2nd of September, a total of 35,296, 591 vaccine doses has been administered. So basically, we are still doing well, but the rate is still very high. Okay, so as it is shown that it is still on the high rate of new cases, whereby it's about 9,000 to 20,000 per day, so roughly around that. Okay, so what happened when we have such incidents that's going on? Our WHO has already recommended that the use of vaccination against the COVID-19 is on. So basically, previously the priority is actually the healthcare workers, then the older adults, and then we move to the rest of the population, which is how our vaccination target has been. Okay, so what about pregnant women? So basically, this is what I get from KPK Kesihatan. We could see that from last year, the numbers of the pregnant mothers that's been infected with COVID-19 is on the rise. Okay, and even the numbers are actually making up the numbers of the beds in the ICU. Okay, you could see that from the category 4 and category 5 are the ones that we are putting in ICU. Hence, those are the numbers of the patients that's actually in ICU. And we are also seeing a rise in the number of deaths in pregnant mothers who has been infected by COVID-19. Okay, so the thing is, I only got the statistic up to June 2021, but we would say that is about the same. Okay, so why we should actually, this should be a concern, but because according to a meta-analysis that that they have done, the clinical manifestation, the risk factors, and maternal and parental outcome in coronavirus as of 2019 that they have done, that's actually comparing with non-pregnant of reproductive age, pregnant and recently pregnant mothers with COVID-19. Actually, the problem is they're less likely to have symptoms, but unfortunately, they are more likely to require intensive care units. Okay, in comparison to non-pregnant women, and their risk factor increases with the age, with the obesity, and their risk factors, and with the underlying medical problems. Okay, and there is also a recent research on the estimation of incidence of admission to hospital with confirmed COVID-19 infection pregnancy, and unfortunately, they were actually in the late 2nd or 3rd trimester. So hence the reason why we are actually encouraging the mother to be vaccinated earlier so that we can prepare for the 2nd and the 3rd trimester. Okay. So even if you look at this data, what basically it's trying to tell you is that there are higher fetal death rate of preterm birth, and also even recently they say it's a higher risk of preeclampsia or eclampsia. Okay, so otherwise it's about the same. So the conclusion of this study is that they say that the infection at time of birth is associated with higher fetal death, preterm birth, preeclampsia, and also higher rate of C-section. However, there are no other additional adverse neonatal outcomes. And pregnant mothers, they actually encourage pregnant mothers to be counseled regarding the risk. Okay, so our current WHO recommendation recommends that the use of COVID-19 vaccine in pregnant women is actually based on the benefit of vaccination to the pregnant woman. It's actually now at this current moment outweighs the potential risk. So we as healthcare workers should help the pregnant mothers to make this assessment. So we have to provide them with information regarding the risks of COVID-19 pregnancy, the likely benefits of vaccination in our local epidemiological context, and the current limitation of safety data in pregnant women. As of now, there is no robust data on the safety data Okay. But what are our maternal concerns actually? Most of the time, they are worried about the risk of miscarriage, safety data to the mother, to the baby. So basically, there are a few research that could you could use to when you discuss with your patients. So there is actually about 2 or 3 research that I found on that looks into the miscarriage rates of patients that receive COVID-19 vaccination. And according to this paper, the miscarriage rates about after receiving a COVID-19 vaccination is actually about 13%, which is actually similar to our expected rates of miscarriage in the general population, which is about 11 to 16%. Okay. Even if you look at this paper, the adjusted odds ratio is just about the same. It's about 1.08, 1.03. So it's basically about the same with the normal population. So the conclusion of all the studies is that the rate of vaccination, miscarriage in vaccinated pregnant mothers was actually equivalent to the normal rate of miscarriage in our normal populations. Okay, so you can see that even in, I think in this paper, they are actually putting in the type of vaccination they actually did, which is Moderna and Pfizer. So what we are using right now is Pfizer. And next is, of course, the safety of COVID vaccination in pregnant mothers. So this is a NEJM published paper in whereby it is done in US. But they actually have a V-safe data whereby they collect the patient's any adverse effect from the vaccination, and they found that actually most of the symptoms that they actually observe is that it's just mild symptoms such as headaches, mild GI chills, and fever is actually quite less frequent, and they rarely have very bad effects, and they actually has the neonatal outcome in patient who has vaccination actually has outcome. The neonatal outcome is actually similar to the incidents that involve in pregnant women that were conducted before the COVID-19 pandemic. So basically, what they are trying to say is that the safety data is still good, but we will need more longitudinal follow up. So the next paper will look at the cohort study. It's actually a cohort study of a number of women. Actually, the total is about a few thousands, but then the total of the women that is actually used in this study is only 133. Hence, there is actually an evidence of low uptake of vaccine in patient that has been actually being taken in this study, whereby 133 women only receive at least 1 dose of vaccine in pregnancy. And when they compare it to the number of in total, they have similar rates of adverse pregnancy outcome, stillbirth, fetal anomalies, intrapartum pyrexia, postpartum hemorrhage, and even C-section, and also risk of requiring high dependency unit or ICU, and even babies requiring intensive unit care. So in the end, this study actually shows that the vaccination has no significant association of risk in comparison to mother that has been vaccinated and mother that has not been vaccinated. So there is a cohort study as well, which actually showed again risk. Whether there is any benefit in patient taking the COVID vaccination. And of course, this mother, when they are taking vaccination, people are actually worried whether they are showing immune response that is needed for us to confer protection to this mother. So this actually is a study on that, and they showed that actually the immune response is comparable to a person who's a normal non-pregnant mother. I mean non-pregnant woman. So the immune response is actually good, and there has been evidence in this paper to show that there are antibodies that were generated from the vaccine. They were present in all umbilical cord and breast milk samples. This is actually an added benefit for the mothers who has been vaccinated. And as this will confer some sort of protection to their babies. Okay, so actually you can use this when you counsel your patients. Okay, so after we have known that all the risks, all the safety profiles of our vaccination. So what are the types of vaccination available for pregnant mothers in Malaysia? So basically this okay, so basically this is actually what you can find from our Malaysian guideline regarding our types of vaccination. So the ones that we are always the ones that we are actually giving to mothers are the Pfizer. The only thing about Pfizer is that it requires a storage temperature of -75. Hence, it means that you must have a good handling, and then that is the only approved vaccination that we could give to mothers that is currently pregnant. Okay, so other type of vaccination such as AstraZeneca, Sinovac, and even the others that we rarely use, like the current Janssen, actually still under research. Okay, so what are the difference between the type of the vaccination that we have right now? So the Pfizer actually uses the mRNA sequence. Actually, it enters only the individual cells to produce the specific virus protein. So actually, it's just by doing this, actually we stimulate the immunity, as this recognizes as our body recognizes the targeted virus protein. So the good thing about this this vaccination is that it's actually simple and quick to produce, and we don't have to use a real viral vector, whereby it confers like a risk of infection to the mother. Okay, so that's the Pfizer. Viral vectors, although it's not viral, basically it's not viral. It's not the virus itself. It's actually a modified viral vector, and it also stimulates the immunity and it's actually still safe to be used in mothers. Why I say this is because sometimes your patient can be pregnant in between, so you can still continue with the same vaccination. So our current recommendation for this population, which is the pregnant mothers, in view of good safety data, most of the study that is available is mostly on Pfizer. So they recommend using community Pfizer biotech. So in Malaysian recommendation, they ideally recommend to be administered between 14 to 33 weeks of gestation, despite there is no evidence to say that there is any teratogenicity in giving patient before or after the specific time that is given. And it is also in the same it is also not contraindicated as what I said, because of it is best to discuss with for the patient to be referred to someone first before they're going for the vaccination, because we actually can give them more reassurance regarding the safety. As I said just now, Sinovac as well as AstraZeneca is actually not contraindicated in pregnancy because the benefit actually outweighs the risk. So the other two that I told you just now, the Janssen and the CanSino Bio, is still under research, and so therefore there is limited safety data regarding this. Okay. So as I said just now, the recommendation by the Malaysian guideline is 14 to 33, because the rationale is that they do not want the patient to be worried about the risk of the first trimester, despite there is no evidence regarding that. And even if the second dose is beyond the 33 weeks, we can still give the patient the time to complete their vaccination. The only contraindication that could be found as of now is that the history of anaphylaxis, any person with previous history of a severe allergic reaction to vaccines, and any component in the vaccine whereby the patient has any allergic reaction, and of course acute febrile illnesses. So as of now, the side effect that is found in vaccination is most common is actually injection site swelling and erythema, and others in terms of more of general side effects such as arthralgia, fatigue, fever, headache, myalgia. And other more common one, which is 1 to 1 in 10 patients actually complain of nausea. So others are uncommon as what is being written there. Rarely that people have cerebral palsy, even myocarditis. So what about as what I said just now, there are patients who actually conceive prior to completion of vaccination. So it is our duty to reassure them, because they actually have still have no need to worry, because the overall safety of COVID-19 vaccine is actually based on our DATs. Okay. So there are multiple recommendations on how to approach this. It is either if we offer the patient to defer second dose until 14 weeks of gestation, or we can just continue the second dose or as scheduled. Or lastly, actually, I would recommend to omit second dose. But the thing is, omitting the second dose is that even though the effectiveness is up to 52% to 89%, but the duration of this protection still remain uncertain. So if I would like to recommend, I would actually recommend the omitting of the second dose as last. Okay. As I said just now, patient who actually took AstraZeneca or Sinovac, we actually recommend them to wait until 14 weeks gestation before completing the second dose. There is still no recommendation on mixing of vaccines because the efficacy, benefit, and safety are still not established, even in pregnancy. So lastly, I would like to share with you our current achievement of our vaccination program in Pahang. Unfortunately, there is no there's no pregnant specific data, but I would say that we are actually doing well because most of our patients are more than 60% are actually currently registered, and of course, meaning to say that in the end, hopefully they will come for the vaccination, and hence our current population that has been given vaccine is about 81%. So for the first dose, and for the ones that is completed, it was also on the high side. So I would say that we are still moving towards a good number of vaccination rate. So I would like to end it here with thank you. And if that you have any question, you could ask me right now.
Hello Kak Nah, pergi meeting tu tak? Nanti Mak Zul macam mana?
Okay. I will assume that there is no questions. Thank you very much for listening in. And assalamualaikum to everyone. Okay. Okay. We will share on the QR code on today's session. Please kindly register. Thank you.